So thank you, Helen, so much for joining me for this conversation today as we celebrate Women's Month and on the occasion of International Women's Day. I want to highlight and focus on women and bladder cancer specifically. So thank you so much for joining me.
Thanks, Alex. I'm Helen Lacy. I live in Geelong in Australia. I'm 49 years old, going to be 50 this year, and I'm pretty happy to be able to make it to 50, quite frankly. I was diagnosed with bladder cancer at 43. I was perimenopausal, and I went to the doctor because of that reason, and I was lucky enough that my GP checked and was pretty diligent. So she detected that I had the bladder cancer and put me on the right path with the appropriate healthcare team in Australia. So I've been very lucky. I'm now 6 years clear. I have an ileal conduit and a stoma, and living life as normal.
It's really wonderful to hear. And Helen, you're also involved with Bladder Cancer Awareness Australia organization in Melbourne, right? Could you tell us a bit more about that?
I am. I joined it's primarily a Victorian-based team, and they're a charity, a foundation that assists bladder cancer patients and carers when they're going through some difficult times. And it can be financial, it can be emotional support as well. We've had some get-togethers where bladder cancer patients and carers get together and just talk about experiences and really share what's going on in all of our lives. It's fantastic.
And I'm hoping that also is coming back to normal and you're able to meet in person now more and more, right?
Yeah, there was a recent retreat. I was unable to go because I was unwell, but there were quite a few people that got together and had a really lovely, relaxing weekend away. They did some yoga, some, general chit chat, just really supporting each other. And we are almost getting back to normal here in Australia. So we're very lucky that we've been able to get together again.
So speaking from your personal experience with bladder cancer, what would you say, what do women need to know about bladder cancer?
I think primarily women really need to be aware that symptoms can present in a way that's almost hidden. Obviously, we have gynecological issues, and certainly in my experience, the perimenopause, I put down all of my symptoms that turned out to be bladder cancer. I put them down to the perimenopause. So I think primarily it's around understanding that those normal, what we think is normal gynecological issues can actually be a symptom of bladder cancer. So it's important that things as basic as something like spotting could actually be hematuria, which is blood in your urine. So it's something to be really vigilant about. I think as a secondary point, that women tend to put themselves last in the household as well. I think it's as a primary caregiver, and that's not always the case, but in a lot of the cases, women act as a primary caregiver and they tend to put themselves last. So they might put off going to the GP because they might talk themselves into that it's not too abnormal a symptom. It could be just a urinary tract infection, and really just put it off. And that's something that I would love for more women to know, that something as simple as spotting could be a symptom of bladder cancer.
What advice would you give to female patients undergoing radical cystectomy, and what advice would you give them prior to undergoing this surgery, things to think about?
Yeah, I think options is a big one. And for myself, I really didn't have much of an option. I had to go down the path of the ileal conduit and the stoma. And that's just where they've used a part of my bowel to connect up to my kidneys. And the urine exits my body through a small opening in the stomach. And that's where the stoma is. And I wear a bag over that. Had I had my time again, I would love to have known to speak to a stoma nurse early in the piece prior to the surgery. Go and see them, talk to them about trying some of the appliances. So had I been able to test one of the bags, pop it on my stomach, fill it with water, and wear it under my clothes just to get a sense of myself and how I would be after the operation. Obviously, there's a lot more that goes on, but just to be able to get that feel for what it would be like to live with that bag, it's certainly not insurmountable. It's a very easy thing to live with day to day, but I'm well past the point of worrying about that. And back when, you know, when there's so many unknowns, I think that would have been really helpful. I also think talking to either the urologist, a GP, even a gynecologist, again, about the impacts of the hysterectomy, because generally a hysterectomy is required when a radical cystectomy takes place. And that could mean for younger women that they lose the ability to have children. So that's something that I think that they really need to focus on. And it's not necessarily the first port of call for a urologist. What their focus is on is saving your life and removing the cancer from your body, but it's the resultant impacts of what happens during those operations. So I think it's really important that you talk to the GP and maybe a gynecologist and really understand the impacts of the full hysterectomy.
Would you say also that it is important to reach out to a patient organization or other patients who may have undergone similar sort of surgery to get an insight from them what it is to live life with that sort of choice, let's say, or that sort of treatment option that they had available to them, and how to deal with the life afterwards? Would that be, yes. Do patients usually find that helpful?
Absolutely. I'm a Cancer Connect volunteer here in Victoria, Australia, and that basically means that I get paired up with patients who connect up through the Cancer Council. And I'm just recently speaking to a 75-year-old lady who is well past worrying about a hysterectomy, but she was so thankful and had so many questions to ask me and was really open to hearing about both the operation, the recovery from the operation, but life after the operation. So once the cancer's out, once the cancer's gone and there's no more scans, it's understanding how to live with the appliance and whether I was afraid of it or, what can go wrong and how difficult is it? Because when you don't know what you don't know, your imagination can run wild. So it's really important, I think, that patients have the opportunity and carers as well. I think it's really important that they have the opportunity to talk to support people and people that have gone through the journey. Absolutely.
And speaking of caregivers, of family and friends, what advice would you give family or friends to help women recover after this surgery?
I think friends and family can sometimes feel a little overwhelmed and a little unsure of just how much support they should offer. But my advice would be for all family and friends to make a roster, get around and don't volunteer to do the cleaning, just go and do it. Turn up for a visit and just, do the dishes, do a load of washing, help without having to get the approval from the patient, because oftentimes the patient might be a little bit loath to accept that help, but really deep down they actually can benefit from it. So I think that's really important. I think it's also important if there's children involved to try and do some carpooling, pick up the children, take children out for the caregiver. And I think it's also really important that friends encourage their friends to get out and about once they have started to recover. I think one thing that was really important in my recovery was having my sister encourage me to go out for a coffee or, go down to the pub for a drink, and don't go far from home. So there's still that little bit of security that if you were to have a leak, on the first outing, then you're not far from home. You can get home and you can change and do what you need to there. But just that little bit of encouragement to get out and get back to normal life. I think that's really, it really does need your close friends to promote that, I guess, and put that idea in your mind and keep you safe in the fact that you're not far from home, but you're getting out and about and getting back to normal.
And what do we talked about this in the past as well, that disparity exists between women and men facing bladder cancer. And from your perspective, why do you think there is this disparity between men and women with bladder cancer?
The disparity between men and women with bladder cancer, I think, stems from the fact that it's generally thought of as an old man's disease. I certainly was told that. I can't tell you how many times I was told that throughout my journey, that it was, sheer dumb luck that I had gotten bladder cancer because it was an old men's disease, which didn't really help me in the fact that, it's certainly something that I was experiencing. And the second part of that, I guess, is as women that experience bladder cancer, I think, from my perspective, that we tend to be more open about the discussion. So I think there's a real, probably a bit of a disparity there in that we're more open to talk within support groups and offer that benefit of experience, I guess. So there's a two parts. So it's really it's thought of as an old man's disease. It's the urologists really centre around men, basically, and the treatment of men. But then there's the support, the extra support comes into play, and I feel that women are almost better off from a support perspective.
And so thinking of, if you could suggest one thing or one wish that as patient organizations and collectively as the World Bladder Cancer Patient Coalition as well, together with the healthcare community, if you could kind of suggest one thing that we could do together to tackle those challenges facing women with bladder cancer and ensure better outcomes, what would it be?
I think the single most important thing for all support groups, for healthcare givers, for anyone to know about, it's the promotion of awareness. The fact that I could have overlooked the hematuria that now, when I look back on, was so obvious, but it was something that I completely overlooked because I was perimenopausal. Had my GP or any healthcare giver prior to seeing that GP performed urine analysis, they would have seen microscopic blood in my urine, and that would have led to additional testing. So I think it's really important that there is that promotion of awareness. I know there's other groups. We have Beat Bladder Cancer Australia based in Sydney, and they've been working really diligently to get awareness out. They're getting pamphlets and posters in public toilets, and really pushing that message of if you see blood in your wee, see your GP. It's critical. That is the single most important thing that we can do to help try and catch bladder cancer early. It may not be able to prevent you from getting bladder cancer, but it certainly may stop it in its tracks.
Thank you, Helen. And many of our member organizations of the World Bladder Cancer Patient Coalition do focus so much on raising awareness throughout the year, but especially in May, which is the World Bladder Cancer Awareness Month, which is coming up very soon. So I think it's one of the greatest opportunities, at least once a year, where we can really engage others, engage the whole healthcare community, but engage all our friends and families to support and help us raise awareness. So I think that's I'm very much in agreement with you that awareness is probably one of the single most important things that we can do. Well, thank you so much, Helen, for joining me today and for sharing your personal story and also your perspectives. And this will no doubt have great impact as well in helping us raise awareness and helping other women as well see and learn from your experience as well. So thank you.
It's my pleasure. It really is. Thanks, Alex.